For joining us in this series of 10 minutes with ILPN today. And first of all, could you just introduce yourself?
All right. I am a social gerontologist, I would say. And I work at the Italian National Institute of Health and Science on Aging over 2 decades now. I have a background in well, I graduated in economics, but I would say I'm more a social scientist in the meanwhile. And since I work in this institute so long, my focus is now, as said, social gerontology. I've been involved in many European projects, and currently I continue working in this field of I would say comparative research in social gerontological topics.
Okay, so how would you, Giovanni, how would you describe long-term care in your country, and what services does it cover, and for whom?
Well, long-term care in Italy has to be distinguished between what the state provides and what the local level, the regions and municipalities provide. The state level delivers mainly care payments based on the level of disability of the person, and they are not means tested, so that everybody can get it, no matter how rich the person is, and especially it's a so-called companion payment, but I would say it's a care payment by the state. Roughly 500 euros per month, 13 times per year. So it resembles a little bit of an income for the person receiving it, a small income. And that's has a major impact in terms of budget also, because you have to think that roughly 12% of all over 65-year-old persons in Italy receive this benefit. So it's a huge amount of money. The local level, of course, is in charge of delivering hands-on care, so home care, providing daycare centers, and also residential care facilities. But I would say that in this field, the number of recipients is much lower, as we have witnessed, especially in the last 2 decades, a new phenomenon, at least for Italian landscape, and that is the private employment by households of migrant care workers. I say migrant because the huge majority of them have a migrant background. So this has, in a sense, represented a disincentive to developing more formal care services. And so this is the situation we are facing right now.
Okay. And what would you say are 3 main policy priorities when it comes to long-term care in Italy?
In the light of what I just said, I would say that first of it would be to ensure that all these huge numbers of migrant care workers, who in many cases are hired on an undeclared basis. So they do not have a regular contract, or it's only partially regular. Many cases we are really in front of an undeclared status. That they become regular through appropriate incentives. They might be fiscal based or of other nature, and that they are integrated much more explicitly into this network of formal care services. So I would say this is the first priority. The second is to connect the state care payments with the delivery of local services, because there is no connection at all, and that makes it a sort of not integrated overall system. So if we would manage to integrate the provision at local level with the delivery of these care payments at state level, we would much more benefit in this country. And finally, what I would strongly suggest, but this is not, I would say, a specific Italian situation, is a more strong integration between health and social care services, as healthcare is mainly considered a system of services, but they are delivered by healthcare units and districts and authorities, where social care is mainly municipality based. Therefore, they do not connect to each other in many cases. This is a problem, but I know this is similar to what happens in many other countries.
If you have an opportunity to introduce one new long-term care policy in Italy, what would that be and why?
What I would do, one which I would do, is to connect the delivery of the state care payment to a declaration of how this payment is spent. Right now, it's free. There is no constraints in how to use it. But I think we need to make clear, also even for planning reasons, what is the use made by households of this huge amount of money flowing into the care sector officially. But so I would say, if I could introduce only one single policy, that would be to connect this care payment with a clear definition of how it doesn't need to be very rigid, it can be very flexible, but still we need to connect it explicitly to what the care delivery itself, hands-on care delivery is.
Okay, and in terms of research priorities, what do you think is an outstanding piece of research that needs to be carried out in the context of long-term care in Italy?
Well, what I think would be good in this country is to connect the issue of long-term care with the issue of intergenerational solidarity.
Okay.
Right now, this is left to the family to recompose all. So the family is in charge of using care payments by hiring privately migrant care workers and so on. And I would say we need to know much or more explicitly to understand what are the logic between the current policy measures and what people think in the younger generations. And I think this would bring to light one main paradox affecting this country, that we are looking for many from workers from abroad to cover the long-term care needs on the one hand, but we have also at the same time a high unemployment rate among young people. So I think the role of long-term care needs to be made stronger and to become a more prestigious activity in the eyes of younger generations. So I would like to see more research done in this field.
Okay. And now I'm just going to ask you a few very quick questions, and I would like you to give me a response number from 1 to 10, where 1 is low and 10 is high. Okay, and the first question is, what policy priority is allocated to long-term care in Italy?
I would say 4.
4, okay. And how aware is general public about what the long-term care system offers to them?
The general public. I would say 5.
Okay, and how do you think the system supports, how well the system supports people with long-term care needs?
I would say 5.
Okay, and what about supporting the needs of carers?
4.
Okay, and the last one, you've already talked about it, but how integrated are social care and healthcare systems or services in Italy?
2.
2, okay. Thank you very much. Well, that was my last question.
You're welcome.